As folks come in, welcome to what is the second webinar in the 2025-2026 Farm to Institution webinar series called Voices of the Network. I know we have a lot of folks coming in still. Feel free to share your name, organization in the chat. We encourage you to share there with other folks. And we'll drop that prompt in a few times into the chat. My name is Daniel Rosen. I use he, him pronouns. I am the co-founder of the Coalition for Carceral Nutrition. And as of this past year, I have the privilege of serving also as a member of the FINE Network Advisory Council. FINE's Communications Director, Sarah Lyman, is here for support and keeping things running smoothly. And FINE's Co-Executive Director, Hannah Layton, is here and will be monitoring the chat also and helping out. Please do share your name and organization in the chat now, and we will kind of dive into this. We have a lot to cover today. A little bit about Farm to Institution New England first. FINE is a dynamic network of communities, organizations, and institutions working together to create a just, equitable, and regenerative food system in New England and beyond. Hannah, I know you're going to drop last year's impact report in the chat, including a report out from the Northeast Farm to Institution Summit held back in April. Please check them out when you have time. And I will just say for my own, personally, I dove into this work about carceral food system reform about 4 years ago when I came home myself from incarceration. And I encountered a lot of the good work going on in New England and FINE's role in promoting change in this sector. I think New England is ahead of most other regions in this regard, and I think that's in large part because of the work of FINE and the network they've built, and that includes many of you all here in the room today. So I was at the summit in Maine about 9 months ago and was enthusiastic about collaborating and building more closely with FINE colleagues, and I had the opportunity to join the Network Advisory Council and was glad to do that. I think, great. I'm seeing a lot of intros in the chat. I know if you are here, you're excited to hear from our webinar speakers, but we'll get there. In case you don't know, this is the third in a series of presentations this winter. As a way to keep some energy going from last spring's summit, FINE is hosting a monthly seminar series, Voices of the Network. Each month through March, you can tune in, and we'll have some more information about that at the end of the webinar. If you can register for each one separately, we'll send you the recordings as well. We would also for sure like to thank the Henry P. Kendall Foundation for supporting FINE and this webinar series. As for today's webinar, this is titled Farm to Facility, Increasing Local Food in New England Prisons. It's the culmination of over 2 years of research by your presenters, working with corrections agencies, food producers, and food hubs, and many of you on this call. We have about 1 hour together and 2 speakers who I feel privileged to call friends and colleagues. We will leave some time for questions at the end, but if you have questions throughout, please drop them in the chat at any point and we'll capture them for later on. At the end, also, we have a brief evaluation, and we'd be grateful if you'll answer that to close things out. Let me get to the speaker introductions, and then I know Britt and Leslie will launch in. Britt Florio is the program manager at FINE. In this role, she manages program development, outreach, and communications to catalyze change. She's been working in the food system since 2010. Prior to Britt's work at FINE, she co-owned a regenerative herb and vegetable farm in the Hudson Valley, New York. And after leaving farm life, she worked as an adjunct faculty member and sustainability coordinator at UMass Amherst. Britt holds a bachelor's degree in agriculture and natural resources from the University of Connecticut and a master's degree in sustainability science from the University of Massachusetts. In her free time, Britt loves dancing and making wildflower bouquets. Leslie Soble is an ethnographer and folklorist who has spent over 7 years immersed in research on the carceral eating experience in the United States and its impacts on individuals, families, communities, and the environment. She is an internationally recognized voice on the critical issue of prison food and currently leads Impact Justice's Food in Prison Project, where she oversees programs and interventions to increase access to nourishing food for people impacted by incarceration. She is a founding board member of my organization, the Coalition for Carceral Nutrition, and a member of the invited faculty at the Nova Institute for Health. Leslie is the author of the new book, Eating Behind Bars, Ending the Hidden Punishment of Food in Prison, published by the New Press just a few months ago in October of 2025. And with that, I think let me turn it over to Britt and we can dive in.
Hey everyone, it gives me a lot of hope that a couple hundred of you registered for this webinar and that so many names that I admire and respect are here to listen to us today. During our webinar, Leslie and I have the privilege of sharing a summary of our aggregated learnings from 2+ years of research. From us, you'll hear a project overview, a summary of our findings, and the challenges reported by both DOCs and producers, and we'll end with a substantial list of recommendations. So let's get into it. This research was funded through the USDA Regional Food Systems Partnership Grant, or an RFSP for short. Impact Justice and FINE worked together to explore the unique needs and barriers to strengthening food value chains, distribution, and food access within New England prisons in order to increase the amount of local, healthy food being served to those who are incarcerated in New England. When we first began this research, it was more of a feasibility study to determine if a food hub might be necessary, especially a food hub run by formerly incarcerated workers. And this is a great idea. And we also found that that wasn't necessarily the main barrier or need to increasing local healthy food in New England carceral facilities. So we're going to get more into it. But first, I'd like to start by explaining some of our methodology and sources around the research we did. So we wanted to get a better understanding of the actual and perceived barriers of the food system. So we started by having food service representatives from all 6 New England Department of Corrections complete a survey via SurveyMonkey in September of 24. And then we followed up with interviews with representatives from the DOCs and adjacent to those DOCs from September of 24 to January of 25. In addition to that, we had reps from 21 different New England food hubs complete a survey via SurveyMonkey in May of 24, and that was thanks to support from the New England Food Hub and Processors Network. We did follow-up interviews with representatives from 5 of those food hubs between October of 24 and November of 2024. And we connected with 3 farmers and producers who were also interviewed during that time. In this research phase, we prioritized farms and food hubs that either had previously sourced to DOCs, were trying to source to DOCs, but were facing some challenges, or at the very least were interested in moving forward and sourcing with DOCs. And we also spoke with a lot of food systems connectors working in New England, such as the Western Mass Food Processing Center, the New Hampshire Local Food Alliance, and the Maine Local Food Switchboard, who provided a lot of great context and information. We presented all of our initial findings and recommendations to all the stakeholders involved, and we got feedback. So that's our methodology and sources. I want to talk a little bit about why we chose New England for this RFSP process. New England is well positioned to serve more high quality local produced food in carceral facilities. It's both geographically compact and abundant in farms, fisheries, and other types of production. There is already a thriving local food movement happening with a lot of advocates who are advocating for values-based procurement, and they have developed a strong network of connections between the region's producers, processors, food hubs, distributors, and institutions like schools, universities, and hospitals. And some of the New England DOCs are already procuring a significant amount of food from local sources, and others have expressed interest in expanding local purchasing. Some of the DOCs have culinary training programs, gardens and farms, and other programs adjacent to local procurement. So it just seemed like a ripe area to work on this project. Let me tell you about a high-level summary of some of our findings. We learned that each state has different policies and practices. Each DOC has its own organizational structure, procurement policies, and contract process to navigate. And these differences make it really challenging to establish cross-state or region-wide initiatives. Varying levels of local procurement knowledge and activity exist across DOCs, with some purchasing a significant percentage of food from local sources, while others do not purchase locally or are not equipped to track local purchasing. DOC staff are interested in buying more local food, but face barriers to doing so. And those who are already purchasing locally have to implement a lot of creative strategies and workarounds to do so. Even considering perceived and actual barriers, there is still a strong interest among regional producers and food hubs in selling to DOCs. And increasing local food procurement should not just be up to the DOC staff and vendors alone. Policymakers, advocates, and other food system actors all across the supply chain also have a role to play. There was many great quotes that we got throughout our interview process, but we wanted to highlight one for you here. I feel like working with prisons is very mission aligned to us as an organization. Our 3 pillars are around farm viability, food access, and reducing food waste. Our view is that everybody should have access to high quality, fresh fruits and vegetables, even if they're in prison. They should still have a good meal. And that was from a Food Hub's staff member. And with that, I'd like to turn it over to Leslie to talk about some of the challenges that we've heard about.
Thanks so much, Britt. I'm going to start off talking about the primary challenges that are faced by DOCs. And as we talked to all 6 DOCs and looked at surveys and had these conversations over and over again, we realized that a lot of these challenges fall into 5 main buckets: contracts, budget, volume, capacity, and culture and buy-in. So we'll talk a little bit more about each of these different buckets and what those specific challenges are. Slide, please. Thank you. The first one is contracts. So we found out that DOCs are often very disconnected from the RFP and contract processes. We learned that in many cases, DOC representatives, and specifically the food service representatives, leaders and staff in the food service department, aren't necessarily being included in writing RFPs, in determining contract terms. And so the people who are closest to the work and who know best about what the needs are not able to participate in those processes, which makes everything harder when it comes to actually enacting food service and purchasing. There are also a lot of limitations on purchasing outside of contracts. So even if there are people in the DOC who want to try to buy local, who know of ways that they potentially, could be buying locally, there are so many limitations on that from the policy that they're unable to do so. And similarly, there are price restrictions on off-contract purchases that sometimes make it impossible or extremely difficult for DOCs to be able to purchase off-contract. And next one is budget. We learned that the cost of food keeps increasing, which is something that I think we've all recognized on the outside as well, even those of us who don't work at DOCs. But the food budget in these institutions, in these agencies, has not increased accordingly. And DOC staff are expected to meet today's food needs and their costs using budgets that were created years ago. So we heard that, they're trying to work with the same budgets that have, been around for 10 to 15 years, but the food costs so much more. And it's really difficult to stay within the budget, and especially to stay within the budget while purchasing high quality local food. The next one is volume. DOCs need to serve large amounts of product. They need to purchase large amounts of product because they're serving thousands of people consistent menus statewide each day. So in most facilities, if, for example, a green vegetable is on the menu for Thursday's dinner time, then they need enough of that green vegetable to serve all of the people in all of the facilities across the state. And it's easier in most cases for them to purchase any given item from a single vendor rather than multiple vendors. So for example, if a salad is being served with the meal and DOCs need a significant amount of lettuce, it's easier to buy all of that lettuce in a single purchase from a single vendor rather than separating that up into potentially 3 vendors who could all source that lettuce locally. Capacity is the next challenge that a lot of the DOC staff talked about. There are a lot of extra steps needed to source, purchase, prepare, and track local food, and that can be really time-consuming when they're working with limited staff. We know that many DOCs are constantly facing staff shortages, and it's the folks who are working in food service and those food service leaders, as much as they're trying, they're spread really thin. The fluctuation of incarcerated kitchen workers also makes it challenging to train people and maintain stable practices. We know those people are cycling through facilities or cycling through different jobs in facilities. It takes time for people to learn different practices, for people to learn different policies, and that's difficult to do when your working staff is constantly fluctuating. And then not all facilities are set up for scratch cooking. Some are and have the equipment to do so, and others don't. They only have the capacity to do cook chill, and they only have the capacity to sort of reheat food and not prepare from scratch. Culture and buy-in was a big challenge that DOC staff emphasized. There's often hesitance and aversion to change within a DOC, which I don't think is, surprising to many of those who've tried to work with DOCs, but there's definitely resistance to making changes. Part of that is because change can also be disruptive for the incarcerated population. We heard that, if a DOC were to change something in their menu and suddenly start serving food that tastes and looks very different, that there could be a lot of pushback from the incarcerated population who are used to something, very accustomed to something being routine. And then again, we talked about the lack of equipment that currently exists in a lot of prison kitchens, but there's also a lack of investment in updating equipment and updating infrastructure that might be required to prepare and to serve fresh local food. So those are the challenges faced by DOCs or identified by DOCs. On the flip side, we also spoke with food hubs and producers and tried to learn what are the perceived and actual barriers, the challenges that they face on their side. So again, those fell into about 5 buckets. We heard about price, state support, volume, red tape, and distribution. The first one is price. We heard from food hubs and producers that when they've tried to work with DOCs, the DOCs are often unable to meet the price points that are feasible and fair for producers and food hubs, which again goes back to the budget and DOCs not necessarily having the budget that they need to be able to purchase food or purchase this kind of food. And not all food hubs source seconds, which might be the only items that are available at a DOC's price point. In terms of volume, we heard from some food hubs and producers that DOCs are unable to meet minimum orders even when they have expected to do so. So sometimes they've put in an order, they've said that they're able to meet the minimum, but then it turns out based on fluctuating population or based on whatever's happening at the moment that they're unable to do that. State support. Many of the food hubs and producers that we spoke with told us that it can be really difficult to find an initial champion at a DOC or another related state agency, maybe the Department of Ag, maybe a procurement department, to be able to advocate for purchasing more locally and regionally produced food. And without that champion there, it can be very difficult to get anything moving, to get anything to happen. We also learned that even when those champions are identified, when relationships are made, that a lot of staff turnover, which happens both on the producer food hub side and on the DOC side, that disrupts those relationships and those previously established practices. And so sometimes the wheel has to be reinvented over and over again, and that process just makes it more difficult for everyone involved. And the other thing we heard is that DOCs are often left out of state incentive programs for buying local. So many times schools, universities, hospitals are able to participate in these programs, incentive programs, but DOCs are not involved in that. And so if they were able to participate in that, it might be easier to be able to get local food into those DOCs. Red tape was another one that came up in a lot of our conversations. The vendor registration process in many states can be time-consuming and confusing, especially for producers and food hubs who are also working with limited staff, also working to get a lot done, especially during the growing season. And there isn't necessarily a tool that's available to walk folks through and help them register as vendors. It can be really difficult to navigate policies and systems, especially when those policies and systems are constantly changing. And food service management companies can add an extra layer of bureaucracy. Not all New England DOCs use food service management companies, but often when they're involved, that creates that extra layer of approval, extra source of potential frustration to have to go through. And similarly, when states are required to purchase through a particular prime vendor and all other smaller vendors might have to go through that prime vendor as well, that adds on that extra layer of bureaucracy as well. And distribution. We heard from a number of the food hubs and producers that one of the most difficult things is that it's challenging to make deliveries, especially across a state, to be able to actually move their product. And even when there are distributors who might be able to help them do that, that often increases the cost for a DOC to add those distributors in and to be able to factor in that support to get food actually from one place to another. And I'll turn it back over to Britt to kick us off with recommendations.
Britt, you're muted. Thanks.
Classic. Thanks, Daniel. It's great to hear about the challenges, and it's also really important to pull out the recommendations. So we have 3 high levels of recommendations we're going to talk about today, and I'd like to start talking about state level recs. Next slide, please. It's really important to include DOC food service directors, managers, those who are involved in food service to review the policy and the request for proposals and be part of that process. Those who are sourcing the food, cooking, serving the food need to be involved. The second thing is that we need to create incentives for local purchasing in both the policies and the contracts. The third is that we need to loosen the terms for statewide vendor contracts. They have to be flexible and accommodating to this unique system. We need to require local food tracking by prime vendors. If we don't have baseline data about what is currently being sourced, then we can't know where the opportunities are for changing those buying systems. We need to ensure that budgets are updated regularly to reflect real actual food costs and that those current facility needs. And especially because each facility is different, whether it's a minimum security, medium, maximum, juvenile system, like each facility in each state is also different. So a universal budget is not going to work. Allowing DOCs to join other institutions in group purchasing and processing, as we've seen done in both colleges and universities and K-12 systems. And we need to permit and encourage forward contracting for local purchases. Then the last one is to clarify and simplify the vendor registration process. So many producers want to work with DOCs, but getting, depending on the state, like getting signed up as a vendor, getting permission, working around some of those RFP contracts are just too challenging for producers. And it needs to be a more simple, streamlined process. Great, those are our state recommendations. I'd like to move on to some DOC recommendations next. It's important to invest in the necessary staff capacity, training, and infrastructure to support purchasing, storage, and the preparation of local foods. And actually, we have someone on this call we have many representatives from New England DOCs on this call, but in particular, I'd like to just call out Kyle Moore for a second from the Vermont DOC, because Vermont has created a brand new position to oversee local purchasing, and they've partnered with Salvation Farms to do some training. So Kyle, in about 2 minutes, can you tell us more about this new position and the training that has happened in Vermont?
Certainly, Britt. We the position is the manager of food and nutritional services, and under that position, it's basically a lot of networking, working with organizations like Fine and Salvation Farms, who's also on here. Salvation Farms does a lot of minimally processed vegetables, and we have a $30,000 grant through the Department of Agriculture over the next 2 years with them, working with them on not only bringing minimally processed vegetables and other forms of produce like fruits and vegetables into our facilities, but there's also going to be a considerable amount of training. In the past, they came in and they trained our food service supervisors in minimal processing so that we could utilize some of the equipment that we have, bulk processing, freezing, storing, and then utilizing these products later in a multitude of recipes that they supplied to us. In the future, we're not only hoping just to get our own staff trained, but we're hoping to get our incarcerated workforce trained as well, giving them further job skills and life skills that could benefit them once they are released.
Awesome. Thanks, Kyle. We appreciate hearing real world examples of some of these recommendations and how you're implementing it. I'm going to move on to the next bullet point of our recommendations here. So we've heard about the importance of staff capacity, training, and infrastructure, but also DOCs need flexible menus to account for seasonality. And we need to develop price comparison lists for common items. When possible, DOCs want the ability to tap into food hubs as both connectors and distribution partners or brokers to provide technical assistance. There's a big opportunity to work with gleaning and food recovery organizations. There is a surplus of food out there, and it's primed to take advantage of gleaning and food recovery organizations. DOCs need to develop surplus or second streams. Often in the industry, this is called opportunity buys. And lastly, Fine has seen great success with DOCs sharing best practices with each other or with their peers. And even though there are different policies state to state, sharing best practices opens up huge opportunities to say, like, oh, this is how you're doing it. Actually, we can advocate for that. Or can I bring this to my higher ups and see if it's possible to change a menu item, to do a training? How did you make that work? Fine has been convening a community of practice to help share best practices with peers. If that is something that you're interested in, you can email me. Now I'd like to turn it over to Leslie to continue recommendations for the next population of people.
Thanks, Britt. Our next set of recommendations is for producers, food hubs, and advocates. There are many things that we can do on this side to also support this. The first one is to advocate alongside DOC staff for changes to state policy and contracts. We can also offer training and technical assistance to DOC staff to build capacity. So for example, as Kyle just brought up, Salvation Farms is doing an excellent job of that in Vermont with the Vermont DOC. We can explore a switchboard model, a solicitation calendar, or other types of liaisons to support the connection of DOC staff and producers and food hubs. I just want to call out the main local food switchboard, which is getting up and running, trying to connect producers and folks on the production side to institutions. Also, in California, we know that they're starting through, I think, the Good Food Purchasing Program, starting a solicitation calendar for institutional procurement across the state of California. So there are different models for how to do this. Also facilitating local purchasing initiatives, for example, Harvest of the Month programs. And if I can do another, putting one of our guests on the spot, we have Hyla Gantanquillo from Impact Justice, who runs a successful Harvest of the Month program with CDCR, the California Department of Corrections and Rehabilitation. Hyla, could you take a couple minutes to share with us a little bit about how Harvest of the Month works?
Yeah, thanks so much, Leslie. So Harvest of the Month is an initiative that we launched here in California with the California Department of Corrections and Rehabilitation. We started by serving one either fruit or vegetable per month. It is locally sourced. We work in partnership with a local food hub that delivers to now all 30 adult facilities in California. I'm also happy to share that as of the beginning of this year, we are now serving both one fruit and one vegetable to the incarcerated people. We also create materials facing the incarcerated population as well as food service staff, where we talk about source of origin information, some tips on how to consume the item. For food service staff, we also offer suggestions on like storage tips or processing tips, just considering some of the institutional challenges or barriers that they might face. And then also we include nutritional benefits so that the population can know what it is that they're consuming, really so that they're aware of the variety that they're getting, and also just encouraging them to eat more healthily while inside.
Thanks so much, Hyla. And through that particular Harvest of the Month program, Hyla has been able to get things like avocados, asparagus, strawberries, mandarin oranges, things that would not normally end up on a prison food tray into the DOC there. So just a huge shout out to that program and to all the work that's being done there. Back to the list. Advocates, producers, and food hubs can also include DOCs in the different gatherings, networks, summits, conferences to continue discussing better ways to get more fresh local food into institutions. Oftentimes, DOCs are left out of those networks, and including them can only be helpful. And finally, supporting matchmaking between DOCs and producers, hubs, and processors. So any introductions, connections, just ways to kick off those partnerships and support those partnerships would also be helpful. And our next set of recommendations, as Britt brought up at the beginning of the webinar, talking about our original direction for this project, we had talked about the idea of creating a food hub that could potentially be operated by folks who have been impacted by incarceration. And as we've determined, creating that sort of regional food hub isn't necessarily what's needed, but we also did want to look into the development of food systems career pathways for people who are impacted by incarceration. We've heard from a lot of folks that they are interested in food systems work, and there is a need for food systems workers across the region, across New England. And so thinking about ways that we can help develop those pathways can support both people who are coming home from incarceration as well as the businesses that are operating across the region. So our recommendations on this list include looking to existing businesses that have already hired impacted individuals for best practices. A lot of them have already sort of gone through the process. They know what works, what doesn't work, and might have good advice and guidance. Developing and maintaining a network of food systems organizations and businesses who are willing to hire impacted folks. When we spoke with a lot of producers, even though many of them, producers, food hubs, many of them had not necessarily been actively seeking out hiring impacted folks, they all expressed a willingness to do so and a willingness to support those folks with employment when they're coming home. Creating programs that support both impacted individuals and the host organizations and businesses, possibly through a cohort model. So making sure that not just supporting incarcerated folks with potentially wraparound services, other things that they might need as they're readjusting to being back in the community, but also supporting those organizations and businesses and how to best support their formerly incarcerated staff. And then developing programs in partnership with DOCs that engage with incarcerated individuals prior to release to spark interest in food systems work, potentially establishing a pipeline of employees. So things like, for example, just want to call out the regenerative agriculture program in the Maine DOC, which has really sparked interest in a lot of people who have worked in that program in food systems, in being able to work in those systems once they're released. And I'll turn it back over to Britt for calls to action.
Great. This will be our last slide before we get into some of your juicy questions from the chat. So all of this information is going to be presented in an upcoming report. So no need for you to take furious amounts of notes. We've written it all down in a concise report, and we hope that you'll read it and share it. Now, we've shared a lot of different recommendations here, and whether you are a DOC or you're an advocate or you're entirely new to this sector, I'm wondering if you can pick one thing from the many recommendations that we've just shared to focus on in the next year and share that in the chat. So right now, just take a moment to envision where you can put your time and energy in the next year, and what's one recommendation that you are excited about or interested in pursuing. The next call to action is to visit FINE's carceral sector website. We have tons of resources and information on our website, and including a large resource database with not only this report, which we'll publish on there, but many other reports and information from Impact Justice, from Center for Science and Public Interest. And so please go to our website and use those resources. The other thing I'd like to just talk about is that funding is desperately needed for this sector. As you can see, we've identified tons of recommendations and next steps to help increase the amount of local fresh food served in New England carceral facilities. But this work does require resources and dedicated investments to move it forward. So if you are a funder interested in learning more about investing in this work, or you're interested in a collaborative fundraising to partner with any of these type of recommendations or programs, we want to hear from you. And you can email FINE. You can email me directly at brittany@farmtoinstitution.org. And now let's get into some questions and answers. Daniel, can you help us? Oh, is that what? Actually, pause. Before we go to questions and answers, I guess I'll tell you a little bit about our upcoming webinars.
Thanks.
And our past webinars. So as Daniel said, this is a series. We've have 2 more webinars left in this series, and we've previously had 2 that's come before. So also on our website, you can check out the recordings of the last 2 webinars, and you can register for the 2 upcoming webinars. And Hannah, maybe you can put the registration link in the chat of how to register for upcoming webinars, which are going to be Sowing Success at Bon Appetit, Local Sourcing and Lessons Learned, and Unlocking the Full Potential of School Food Systems. Okay, now over to you, Daniel, for questions and answers.
Yeah, great. Thank you. And thank you to you and Leslie both for the presentation. And I think, summarizing a couple years worth of some very in-depth work. I think I know, because we've had these conversations, that we've all thought about what follow-on work would look like and what additional funding could do to further the work. I think what comes up for me as we've talked about this, and just drawing on my own experience, and it kind of relates back to one of the quotes that you put up on the screen. In my experience of eating inside, it's just nothing was fresh and local. Everything was heavily processed. Everything was just cooked and reheated to death. I almost hesitate to bring this up, but we have new dietary guidelines that emphasize eating real food. And that's just so often the opposite of what's served in prisons and jails most of the time. And so I want to kind of get back to the why, and start off the Q&A. We have a lot of good questions teed up already, but just start off the Q&A by asking you and Leslie both, why is this important? You've identified the barriers. There's a lot of barriers for both agencies and producers. And you've given us a whole range of recommendations and creative solutions, right? I mean, procurement reforms, switchboards, food rescues, harvests of the month, opportunity buys, a lot of potential solutions. But I think maybe help us, and we can start up this conversation just remembering why breaking down those barriers matters, if both of you want to talk about that a little bit.
Yeah, I mean, I can start off and just say, personally, this matters to me because I'm a food justice warrior. It's my job and my role in life to make sure that everyone gets to eat good, healthy food. I believe that that is a basic human right, that regardless of who you are or where you live, what your race or your class or your history is, that you deserve to eat nourishing food. And I believe that our justice and carceral system's really unjust. We have far too many people incarcerated in this country, and the whole system needs to change. And one way, there are many ways that that change needs to happen. And for me, my wheelhouse, my expertise, my passion is around food. And I hope that our food system within the carceral context changes very soon. And I hope it's part of a bigger change, or at least a catalyst for changing the rest of the system as well. Leslie, how about you?
Yeah, I
thank you.
mean, piggybacking off of everything you said, Britt, because I agree with you, as you know. But also thinking about just the extra harm that is being done by the food in carceral systems in this country. We're basically sentencing people to however much time in prison, plus potentially heart disease or diabetes or increased anxiety and depression, or any type of physical and mental health problems that come with not having a nourishing diet. And so, there are obviously so many things that are problematic about our carceral systems, but food is something that we should be able to change fairly easily and fairly quickly, while we continue to address the other issues that mass incarceration brings. And so, again, like Britt, you were saying that everyone deserves good food. I think as a country, we have this sense of, locking people up and throwing away the key and pretending that they don't matter anymore, when in reality, these are people's parents and children and partners and friends and other kinds of loved ones. And many of them will, most of them will actually end up coming home from incarceration and will potentially be significantly worse off than when they went in because of the food. So this is something that we should be able to change, and that I think we can change, as is evidenced by some of the movement that's actually been starting, and particularly starting in New England. And also, sorry, just to keep rambling for a second, I think on the flip side, we're supporting the wellness of people who are eating that food. But on the other side, right, we all know how important it is to support local producers, local growers, and our local food system actors, and to make our local food systems more resilient. And so doing this work is a way of doing both of those things at the same time.
Yeah, thank you. Thank you both for talking about that kind of bigger picture. I want to dive into some of the questions that we've already got. And a couple of them came early from Kathy Stanton, who said, I'm struck by the similarities with other kinds of institutional procurement and wondering if the study separated out anything that seems unique for DOCs or prisons. And let me just turn it to either one of you who wants to answer on with all of these, to either one of you who wants to address these.
Yeah, I can start, and then Leslie, feel free to fill in. But I would say that one of the biggest differences with the carceral sector versus schools, colleges, hospitals is that there's a different external pressure or advocacy, and we are seeing that change. But I think for the general population, it's a lot easier to advocate for kids needing good food, sick people needing good food. And there is some resistance that we are actively pushing through, that incarcerated folks deserve good food too. And the other difference is that often for folks who are incarcerated, what is served to them in the chow halls is their only food choice. Whereas children in schools, they might get breakfast or lunch there, but then they have other options when they go home. They have options for their parents to bring them in food. If you're in a hospital, your family can bring you in food. That's not an option for those incarcerated. Family members are not allowed to bring you food or mail you food items. Often the only other choice is the commissary, and prices of the commissary are extremely expensive, like beyond airport prices. And the food in the commissaries isn't really food. It's everything that we know is not generally healthy for you. High sodium, high sugar, high fats, highly processed food items that are way too expensive. And so it's just another example of how unfair the food system is, that there isn't the same level of choice. And the other big difference is security. So when food gets delivered to a college or university, it doesn't have to go through an intense security check. It doesn't have to stop in the loading dock. The driver doesn't have to go through a background check. When the food is then brought into the facility and is being cooked, in other institutions, like a knife or a sharp pair of scissors, they don't have to get checked out from a system and counted at the end of the day. So there's a whole level of security in bringing the food in, cooking the food, and serving the food that doesn't happen in our other institutional sectors.
Yeah, I think those are all really important differences. And Leslie, before I ask you to address that, I was remiss in just not mentioning that I think Sarah's about to drop the survey in the chat. If folks can take a moment to just fill it out, would really appreciate that while we address some of the questions and answers here in this part. But Leslie?
Yeah, I think Britt gave a pretty good summary of both the sort of background and logistical issues. The one thing that I will add to that is just the price point. If you look at the meal for meal price point, typically prisons have a lot less to spend. In many states, go ahead and compare the average cost for a school meal for like one, elementary school age child for lunch, and compare that to the cost per meal for an adult human who's living in a prison. And there's significantly less money allotted to the adult human in a prison per meal than there is to the school child. So it's just a bit of a different setting when you're, looking at the price point and what those food service managers have to be able to manage with.
Yeah, I think, go ahead. Sorry, Britt.
I'd say the last addition is that the contract system is much stricter. In some states, there's like zero wiggle room for the Department of Corrections to buy off contract with prime vendors. And that's maybe not something that we see in colleges or universities or our other sectors, is such strict contracting processes.
Yeah, I think it's one of the things we're struggling here with in Washington, D.C., as we try to work with the DOC here for sure, is those contracting barriers. Thanks. And I have another question from Kathy, which I think is very relevant. Having talked with incarcerated people about how they feel about prison food, I wonder if the quote, "they don't like change" perception is very one-sided. Are there any plans to gather data from incarcerated eaters themselves to inform this work?
I can jump in and take that one first. So first of all, thanks for the question, and it is an excellent question. One, I would like to say that the challenges that we were discussing were challenges that were reported to us by DOCs, but so that is the experience of many of the people who are working in DOCs. That was, what they reported as a challenge that they've experienced. We did not do like a formal data collection from incarcerated people with this grant. We just weren't able to do so for multiple reasons. However, we've had many conversations with people incarcerated and formerly incarcerated in New England throughout the past several years. So we do have a sense that people do want to see change. And again, having surveyed and talked to hundreds and hundreds of people across the country at this point, yes, there is a larger pattern, obviously, in wanting to see this kind of change in prison food, supporting better food, more nourishing food. I will say that When it comes to what people perceive as better, tastier, more appealing food, some people think that, for example, like fresh fruits and vegetables are the best thing, and some people think that other things are better or taste better, and some people are resistant to change, and some people would like to see change. And that would be if you surveyed the general American public on food. And I would say that the breakdown in percentage of people who like certain kinds of food and don't like other certain kinds of food is probably about the same among incarcerated people as it is in people in the general public, right? There will always be people who would prefer to eat certain kinds of food and would prefer to have something different in whatever setting you're talking about. So incarcerated people are not different from anyone else in that regard. So yeah, there would obviously be some resistance to change for some people, and some other people would also be very eager to see other different kinds of changes. I think everyone wants better food. I think what better food is to everyone, what appealing food is to everyone, can be a little bit different.
Yeah, for some reason, when a couple times pears were served in the chow hall, there would be pears left everywhere, and I would just grab them all. I don't, People didn't want pears. I don't know why. Next question, Doug Bradley asks, is there any challenge to implementing local buying related to the use by food service providers of specified product purchasing programs?
Doug, I'm actually wondering if you can unmute yourself and explain that question a little bit more.
Yeah, thanks.
Yeah, so the larger food service suppliers, and not to pick on any individuals, but Aramark as an example, has a specified purchasing program where there's a massive amount of rebates that go back that can account for up to 60% of the company's profitability. So to what degree is there an instance where, or is that something that you've run into where those forced purchasing programs on the food service provider itself are something that really steers you away from local purchasing, where those people aren't able to contribute the kind of money back to the corporate provider? And it's true for Compass, it's true for Sodexo, it's true for any of the entities that are in that food service space, if that clarifies enough.
Thanks, Doug.
Yeah, there's a couple ways to answer this. I'd say local food benefits everyone. It benefits producers, it benefits eaters, it benefits the environment, it benefits states, it benefits policymakers, it benefits friends and families. And I would like to see contracts that allow more flexibility for local purchasing. So I think there's more opportunity to bring folks together who maybe are not talking, but working in the same space, but are not talking. They need to be talking. So whether that's the prime vendors, the food service directors, the incarcerated kitchen workers, along with folks like Sodexo or Aramark, like I would like to bring all of those folks together in the same room to figure out how to create a system that maximizes opportunities and benefits for everyone involved. Leslie, what additions would you have?
I think that was a good response, Britt. So just in the interest of time and making sure we get to other questions, I'll let us move on, but I think that was a great answer.
Yeah, thanks. I think Lisa had a question about Harvest of the Month and sharing more information on that. I think that's also something we can do when we send out the recording and more information to participants here. But is there anything, Leslie or Hyla, even that you want to say further about that program right now?
Hyla, maybe.
Yeah, I'm sorry. Lisa did ask if there's any other states being considered or partners needed to support that program specifically.
Yeah, and Lisa, I actually know I have an email from you in my inbox that I need to respond to. But yes, I think there's definitely interest in expanding Harvest of the Month and trying to figure out where that might be possible. So we'll follow up. Absolutely.
Sounds great. Thank you. And John asked, given that there's a lot of change starting at the top, what kind of advocacy seems to be most effective and persuasive, and what tips would you have for other states to move forward toward more supportive policies and leadership? How do we get those with the power to change? And I think Kyle had dropped some helpful thoughts in the chat. But I think if either of you have any thoughts about this, for sure, leadership matters, right?
Absolutely. We definitely know that the Department of Corrections and the carceral system is a very hierarchical system. And so for those working in it, you need lots of permission from higher ups to make change happen. In New England, Vermont, and Maine have been able to make a lot of advances with local healthy fresh foods. And those are both states that have commissioners and leadership that are supportive of healthy food initiatives. And I think that type of leadership is really important. And that also helps change policies and protocols where there is red tape or where there are actual barriers.
And I would add just figuring out what arguments make people want to take action. So for some people, it's, supporting local economies. For some people, it's, more green purchasing and more environmentally friendly. For some people, it's public health and the lowering of healthcare costs for the state. Just figuring out what makes different kinds of advocates tick and being able to uplift those particular arguments, because as long as it has the result of getting better, fresher food in, it's going to do some good in all of those areas.
Yeah, thank you for that. I think one more question from the chat. Briefly, Sycamore asked, how do you recommend working with food service supervisors that are reluctant? Often food service directors are interested in sourcing locally, but bosses are not on board. It's one of the things I was struck by in talking to our colleagues in the UK. They're working directly with local catering teams, as they call them, food service supervisors. So any thoughts on that to close us out, Leslie or Britt?
I mean, any change in our food system is based on relationships with people. And so start with building trust and building a relationship with that human being that you're trying to work with. Find out start with asking questions of in your ideal world as food service director, if you could have any kind of support to create the change that you want to, what would that support look like? What would that change be? And sometimes it's helpful to just start working with the people who are less reluctant, to the people who are already champions, to the people who are trying, find those people and start where you can with the collaborations you can, and just continue advocating. It is a frustrating system. Please don't stop. We need you to keep going and pushing through, even when folks are reluctant, even when it's hard. And let's work together to figure it out.
Thank you. Anything, Leslie, on this briefly?
Yeah, just make sure that you're listening to people who are concerned and taking their concerns seriously. I mean, I think that's what most of us want, is for when we have questions or concerns, for those things to be taken seriously. So like Britt was saying, using that as a point to build that relationship and talk things through and really addressing those concerns on a one-to-one basis.
Yeah, thank you both. And to my mind, just to editorialize this, is one thing Find does so well, is build those relationships. And I think it's one of the real strengths of this network. And I think with that, we are at time. So I will close this out by just saying thank you to Find, to all of you for joining us, to our speakers, to our sponsors, and we look forward to connecting with you again. And we'll follow up with the report and the information from the chat.
Thank you all for being here.
Have a great day, everybody.
Thank you.
Thank you.